Является самым важным для человека – это право человека на здоровье. Поэтому Алматийская конференция была созвана в результате того, что в мире был кризис большой по оказанию, получению медицинской помощи.
Primary care is something that has evolved a lot in the last 40 years since Alma Ata Declaration was signed, adopted. And it inspired countries to work more on primary health care. And we need to think back in history what change it brought. It brought the change for us to think more about social determinants of health.
Primary healthcare, in fact, is an approach which permits the health system to deliver health services as close to the home and the communities of the patients and the people. It's an approach which puts the people first. Relationships between the people, the patients, the doctors, the nurses, the social workers, and the whole system as such.
The WHO European Center for Primary Health Care organizes the work in 4 pillars.
Countries like Kazakhstan, Uzbekistan, Tajikistan, Turkmenistan have already done very good measures in ensuring quality control, quality insurance, and quality improvement for their patients and for their citizens. And this is something that is very commendable for these countries, and best practices should be shared between these countries, but also globally. And I think the WHO can help very much in expanding these best practices and have them utilized in each country, so each country doesn't have to repeat mistakes that other countries made and reinvent the wheel.
We know that countries are moving and innovating continuously, and we want to capture the evidence that is behind this movement in order for us to have scientific evidence that we can share with other countries on what works and what doesn't work.
Kyrgyzstan and the Minister of Health in Kyrgyzstan has adopted the primary health care strategy, and we are very excited from WHO's side to help them.
In order then to move the national agenda, what we do is to work side by side with countries, providing policy options, what we call policy analysis in countries. We tailor that evidence, we understand the countries. Each country is different from each other, not only in cultural issues, but also in the way they deliver services.
Высшая школа общественного здравоохранения была организована в 1997 году на основании соглашения между Европейским региональным бюро ВОЗ и Министерством здравоохранения Республики Казахстан. На сегодняшний день наш университет является лидером в области подготовки и непрерывном профессиональном развитии специалистов сферы здравоохранения и, конечно же, непосредственно специалистов первичной медико-санитарной помощи.
But we also provide policy advice and recommendations that are tailored for country support. And in order to do that, we do policy dialogues. We engage in dialogue not only with the national authorities, but with the oblast, with the regions, with the municipalities. We bring together around the table all the stakeholders that are relevant for specific issues.
But there's a problem with many of the doctors' offices.
I'm a communication specialist, and I teach the workshops for WHO on provider-patient communication.
He also did not interrupt the patient. The patient's aggressive and upset. He didn't interrupt. He didn't try to...
I'm quite glad to be here also in Almaty, in the birthplace of primary healthcare, to see the willingness of this office to bring even more different countries together in different partnerships, like the Northern Dimension Partnership today, to work on the topic of primary healthcare.
All this work cannot be done alone by our team, so we partnered with many other institutions, academia, think tanks, associations, professional associations. So we network to make sure that countries can support each other in a more horizontal cooperation.
We know from evidence and good practices in our member states that health systems with a strong primary healthcare are systems which are much more cost-effective, which are delivering far better health outcomes than those systems with a weak primary healthcare.
Именно Алматийская декларация потому называется Великой хартией мирового здравоохранения, потому что именно благодаря Алматийской конференции право человека на здоровье было признано всеми государствами планеты.